So, good morning, everyone. Which is nice to finally meet you today, face to face. Good morning, everyone. My name is Craig DeLarge, and I am here to speak about what I'm going to call the landscape of digital mental health. I'm going to go through my slides pretty quickly because you'll be reading them faster than I can probably speak about them. But I am a curator, researcher, and strategist in the digital health field generally. I've spent 3 decades in the pharma industry. I've also been in academia as a professor. And so during a sabbatical back in 2014, sitting at my desk, it occurred to me that it would make sense to actually begin to explore what are all the ways that digital technology is actually being used within the mental health and behavioral health spaces. And so the work that I've been doing has really been around research and education. I've been working on it for about 4 years now. Just a couple of weeks ago, because I spent the last 3 years in Singapore working for Takeda Pharma, I actually left Takeda, and I'm going to be spending the next couple of years now working on this project. One of the reasons I'm here is I'm looking forward to having talks with various of you and seeing if there's possibility for partnership. Some of the things that have been done up to this point have been around an innovation challenge that we did back in 2015 in New York, and that's kind of gone on every year since. And we're looking forward to having more and more of these types of meetings to bring people together around this topic. There's a survey that I've developed that I'm looking to grow the sample around right now that gets at looking at attitudes, trial, and usage of digital technology among treaters as well as consumers. I've started blogging recently my research on Medium to make kind of the things that I've been doing and thinking about more accessible. And I also have a database, and I'm going to share some insights from that database in this talk today. So this quickly are kind of the points that I want to work through today. And I want to finish up a bit early so there's an opportunity for Q&A actually with all 3 of us as speakers, as we didn't take that opportunity earlier. So, what is digital mental health? Well, I think we all kind of get generally what it is. I will tell you that as a person who comes from the perspective of commercial and business, I tend to think about digital and the internet through the lens of the 3 C's that we've been talking about since the mid-90s when this thing first started to emerge. That is about content, community, how we bring people together for better or worse. And I use the term commerce, which I know might offend people who are more on the academic side, but appreciate that commerce is not just about money. Commerce is about any exchange of value, whether it's monetary or otherwise. And the point is that digital has done this to the tune of trillions of dollars for the global economy. We're now on the threshold of examining how do we continue to do this for health and mental and behavioral health in particular. This is a chart that I've kind of built to help me with my own thinking about this. What you see down the left are some general categories that through my research I've kind of clustered the various applications of digital within the space into. And there's a lot of debate that can be had about whether this is too general or not precise enough and that sort of thing. But one of the things that we clearly see here is that there is no lack of application and value and contribution that the various types of technological applications that have been developed can lend across the care continuum. And then when we take a look at the various types of gaps that we all grapple with within the system, everything from access, geographic and time and financial, to detection, stigma, education, then getting into kind of more of the clinical realm, accuracy of diagnosis, efficiency and effectiveness of prescribing. So one of the things that I am simultaneously proud of but also bemoan, and someone brought this up in the panel earlier, is that 3 decades of being in the pharma industry, I can see that we have done a great job, but in some respects, too good of a job in terms of teaching society almost addictively that anything that ails you write a prescription and take a pill for it. And I have mixed feelings about that in my reflection as a pharma executive. um, but what gives me hope is the recognition that the same way that we've been as successful in teaching societies all over the world that when something ails you take a pill, human beings being consistent as we can also do the same in this particular area. I have a grandson who's 3. When I do this work, I think about how we create a future where when he goes to university in 15 years, I get an email or maybe a hologram from the university telling me about how they have a whole suite of social, technological interventions that are a part of the experience of his being at university that will reduce by X%, likely based on his genome, the chances that he will succumb to some sort of mental disorder in that most vulnerable of life stage between 18 and 25, when most mental disorder comes upon us as human beings. So that's kind of the vision I like to put out there that I see we are working on in terms of the change that we want to see. We can go back a few decades to see the change that's happened around pharma. We're working on a different kind of change now that has a historic precedent. So now, as much as we can talk about the potential and the wonder of digital within this space, I think we also have to consider that there are a number of rate-limiting barriers or factors that we have to continually work with to build trust, to the theme of this conference these next 2 days, to really help us to open up what I'm going to call a floodgate of adoption and understanding around this. Stigma and discrimination, big issue as we all know, causes a lot of people not to raise their hand even if they feel they need it when it comes to using the technology. One of the things though that's been heartening for me is as I've thought about it, and I've read some things about this, is to understand how the anonymity of digital technology is a plus value add from the standpoint that it's the potential for many millions, hundreds of millions of people to actually get help without needing to disclose. Clinical efficacy, and I've got a chart about this a little later, is something that, particularly when you talk to treaters, they say, well, I'm not going to use that because I'm not even sure that it works. I think that there is not as much a lack of clinical efficacy evidence as there is a lack of awareness of what is out there. And certainly to a comment that was made in the panel earlier, we need to continue to sharpen and get better at the methodologies that we're using in order to become even more sure. Not just about the general efficacy, but specific efficacy within different groups of users. Privacy. We've already seen some lawsuits with some of the telepsychiatry firms that are out there around breaches of privacy and security. Some of it real and violative of the law, other of it perceptual. Either way, it's real. It is something we have to continue to address. And then the digital divide. Now, I'll tell you that after the last 3 years of working in medium and low income markets out of Singapore, it has definitely become evident to me that a lot of the technologies that we've developed to this point are really for affluent, high-income nations. We are seeing more and more development of appropriate technologies in this area in the east and the south of the world, but this is something that we really need to keep an eye on because the fact is that 80% of the world's population is in the east and the south of the world. The burden of mental health disorder in those populations continues to grow, exacerbated somewhat by the adoption of Western lifestyles. And so we need to create solutions that are good for the masses and appropriate for various other types of cultural contexts that we see up on the planet. So now, let me get into some categories. You saw this already, and I just want to quickly kind of go through each of these categories and give you a perspective, as well as show you some examples of the different companies that are within these different spaces. I recognize one of the things I felt a little insecure about is I thought, I'll present this and everyone will go, oh, I do that already. But I hope that everybody sees at least something here that's an aha for you and that you haven't seen before. So when we look at psychoeducation, the potential of which is that it provides the opportunity for ubiquitous knowledge, but also support. So this gets back to the comment that was made by a panelist earlier about the value of the relational element of art that needs to be brought into this. It's not just about information, but also relationships. Here you see a few examples I think you might be familiar with. Psych Central probably being one of the grandfather of this category. Psychoeducation manifests itself in a lot of different forms, even up to virtual reality. Many people don't realize that for more than a decade now, Second Life, how many of you are familiar with Second Life, the virtual reality world, has been used as a platform for support groups. It provides anonymity. There's a form of cosplay, so you don't actually know who the person is. So people come in as their avatars, and actually there have been support groups happening in that kind of virtual reality platform for many, many years now. When digital comes into this, I see this anonymity point as something for those that are concerned about stigma that's very helpful. But certainly in this space, and this is something that I think we will continue to grapple with for a while, the risk is around accuracy. So you go to Google and you do lookups on information related to mental health, or any kind of health for that matter, and the information you get back can be all over the place. And so there is a need for kind of this continued curating, I'll call it, and verification of the types of information that's out there, so that what people get is most useful to them and they understand how to sort through it. This is not just an issue in mental health or healthcare. We're suffering with this as societies with information in general. And it's an area where we need to continue to develop skill. Now, care and wellness platforms is a huge generic because in many respects, just about every application that you see in some way has an element of a care and wellness platform in it. And in many ways, you could say that digital mental health is the monetization of X behavioral therapy. So when I look at my database, which has a bit over 150 companies in it at this point, what I can see is that digital has created a huge potential for taking many proven behavioral therapies and democratizing them, as well as making the means of how you interact with them highly customizable and scalable. So the fact is that you can go on your phone now and you can get any number of services that will give you the ability to video conference with a doctor, or just talk on the phone with the doctor, or just chat. By the way, not just with the doctor, but with peer support, not just in your local community, but possibly all over the world. Right down to chatting with an artificial intelligence robot. And this is 24 hours a day, 7 days a week, whatever you like. And then of course there are many hybrid forms. When Serafina, when you talked earlier about the idea of blended or mixed care, right? You see that with these types of platforms, there's great deal of potential around this. The data that these platforms generate is also increasingly, amid its risks, providing the opportunity for us to have deeper and more comprehensive insight around a lot of areas: how people interact, who interacts, what particular combination of therapies or mode or context of therapy happens to work. So this is a very, very ripe field. And when you look at the types of companies that are in the space, you see kind of the scale from really big companies that are at almost IPO stage that are engaged in this, right down to very small sorts of companies. The risks that you see here around usability, and I think usability is probably one of the key areas behind the gap that we see between the number of solutions in the marketplace and adoption of those solutions. that is something that we have to continue to work on. Security and privacy for sure. Interoperability, the ability of platforms to speak to one another, as well as those platforms that are digital to speak to platforms that are in what I'll call the traditional paper-based healthcare system, as it were. There's a lot of social and bureaucratic inertia that needs to be overcome. So appreciate that the adoption of this technology is at least, no, actually not at least, is more so a cultural change project than it is a technological one. The technology is actually easy. It is getting how we currently do things and what we currently trust to yield in the face of something new that we have to continue to work on. And then, of course, reimbursement. Always the question of who's going to pay for it. This is a chart that I actually built from one of the blog posts that I have on Medium. What you see here on the left side is how I envision the current system works, right? And so, here's a dot. So going right, you have the consumer or the patient at the center. Then there's caregiver, treater, education, payers, law enforcement, and social services. And this triangle, at least as a pharma person, is how I tend to think of the world in terms of the key transaction that drives value. But when you look at a lot of the technological solutions that have been developed around care and wellness platforms, you can see that there is the potential to create a future where there is a lot more integration and line of sight and communication across the entire system. And I think one of the things that's rather compelling for me is to think about how social care and law enforcement and education, when we think about youth, get integrated into this. Being from the United States, where I think nearly half of our prison population is mentally disordered. So in the US, our prisons have become our psychiatric hospitals to too great a degree. So there's a huge need for us to consider how law enforcement and social services actually gets integrated into what we think about as mental health in our particular context. Now, a subcategory but significant of care and wellness platforms is telepsychiatry. The beauty of telepsychiatry being that it has bridged space and time when it comes to access to care. So you consider kind of the global shortage of treaters that exist to begin with, coupled with shame around stigma, coupled with the inconveniences of having to commute to offices, coupled with the inefficiencies of wait times. This idea of being able to use technology to give people a more instant access to care in a context and at a level of richness of interaction that is best for what they need at any given time has a great deal of potential. And I would dare say when you look at the types of firms that are being best funded, you see a lot of it in this particular area. You also see a lot of targeting within this area. You see as many of these companies actually going after large employers as you see going after governments and healthcare systems. And again, because that's where the money is. And I say this kind of tongue-in-cheek. When I see organizations willing to invest in these types of solutions, one side of my brain says, wonderful. They really care about health and people. And then the cynical side of me says, no, they care about economic productivity, right? But I guess the point is to capitalize on the change that's emerging to get the best result out of what's actually emerging, more than complaining about it or promoting it. But when I talk about the idea that we need a responsible adoption of these technologies, the responsible piece is making sure that growth happens, but growth happens in a way that is proper. Then biosensors. So biosensors happen to be the eyes and ears, as I think of it, of digital mental health. All of the wearables, and there are bunches, I actually have a whole other talk that I do on digital mental health wearables. It's on YouTube for any of you who are interested in it. All of the wearables kind of fit into this category. And then you have a whole category of companies in this space that do nothing but develop sensors as original manufacturer that they then lend to other types of solutions that integrate those sensors into what they do. But appreciate that while certainly there is the risk around privacy and security when it comes to sensors, the beauty of sensors is that it's giving us an ability to have a layer of insight around mental health that has heretofore been entirely invisible to us. So when you look at devices that actually you can wear on your wrist, I'm trying to think which device is that. It escapes me right now. But there are sensors and devices that you can wear now that will make you aware that you are psychologically overwhelmed or sinking into depression or becoming overly anxious, even when you are not consciously aware of it. There's a particular wearable that I like to use from time to time called Aspire. It's a little pebble that you wear in your waistband. It reminds me constantly that when I become anxious, I stop breathing. I hold my breath. And the reason it can do that is because it constantly monitors the expansion and contraction of my waistline. This has been very helpful to me, actually, right? And I could go on and on about this. I guess I should also point out, so Abilify, my site, is very interesting. I'm sure many of you have heard about the work that Otsuka Pharma has been doing, I think for about 5 years. It took them to get to this with Proteus Health, where there is now a pill with a sensor in it that's connected to a patch you wear in your skin that then communicates with your iPhone, which can then transfer it to the cloud so that your electronic medical record and your physician can see it. Lots of ethics and rights discussions coming up around this. And it's going to be very interesting to development to watch how this particular digital therapeutic evolves. With Think, this is actually a wearable in the neurostimulation area that most wearables tell you what your body is doing. This one actually does something to your body. They actually make the claim that they plan to be as good as many psychotropic drugs, but without side effects. So quite interesting. This makes a pharma person kind of break out in sweat. You know, when we read that sort of stuff. And then virtual reality. So this is the other real that heals, is how I like to refer to virtual augmented and mixed reality. Where we're seeing some really fabulous work done in this area around exposure therapy for PTSD and phobias. There's this company actually I came across in Singapore, and I think that Applied VR actually also has this application of using eye tracking methodologies administered through virtual reality to track the longitudinal health of your memory, and which is beginning to yield the possibility for earlier detection of dementia, right, through virtual reality. So it's quite interesting. Virtual reality also has quite interesting applications in the education field. So there have been some quite good programs that have gone after stigma and work to increase empathy of people who experience particularly psychotic symptoms and mental disorders by actually giving you a virtual reality scenario that lets you experience firsthand what that person is experiencing. And the data and algorithms, which I think of as the brain, the mind, and the mouth communicating insight of digital mental health, is a whole area unto itself. Now, pretty much every solution obviously produces data, and very many have some form of algorithm embedded in them. But we're now seeing a category of companies that their full stock in trade is around this idea of developing algorithms and data. Much like the sensor manufacturers, they develop original applications that they then look to lend and sell into other types of solutions. Mindstrong is kind of the big media darling right now from the standpoint of this objective standard of diagnostics that they're going after, which some people are saying will replace the DSM at some point. We'll see about that. But this is a quite an interesting area. Yet, there's still the issues, and this is a big issue around security and privacy here, right? Interoperability is a risk, as well as validation, which is ongoing. So, that's how I, in the research that I've done and the database that I've built and continue to build, kind of envision kind of the big categories of digital mental health as a way of just helping you kind of think through and see what the possibilities are. And this is research that will continue to go on. Now, I'm going to share some insights from my database, but it's important to have some caveats. So understand that my database is a sample, not a census. I started out thinking I could get a census. I was disabused of my arrogance rather quickly. It is a sample, though, that is representative in terms of variety, but not proportion. Once again, just looking at like meditation apps make you run out of the room screaming because there are thousands of them, right? But in terms of the variety of applications, these findings are directional, not statistical. And understand that I did a review of all the companies in my database to understand who had clinical studies or not. I'll show you the percentage that there were, but appreciate this is saying they have a study. One of the things I discovered along the way is that it's not necessarily saying that the study is of significant quality. So that was an interesting aha for me also. So we talk about clinical efficacy. 32% of the companies in my database claim to have a study. Now, I don't know how you feel about that number, but it was a larger number than I expected to see, given what I tend to hear anecdotally when I speak to people in the field. But it occurred to me that there are actually two types of kind of, I'll call it validation, right, that you could look at. The majority of companies are saying that we're effective not because their solution has been submitted to a study, but because they happen to be the deliverer of a methodology that has been proven in the literature to be effective. This is kind of a bifurcation that also caught me off guard. And then there are others that they themselves are a therapy or diagnostic. They're usually going for some form of regulatory approval with FDA or something like that. You know, the eye tracking is one area, and then there's a whole neurostimulation field. And you see a bunch of different methodologies. I love to buy these gadgets, actually, and experiment with them. But then over here, you see that there's a broad number of solutions out there that are the deliverer of therapy. So in many respects, you could say, getting back to the point I said earlier about digital mental health, a way of describing is the monetization of X behavioral therapy, which is not to criticize it, but to talk about the fact that when we talk about efficacy, we will continue to become more refined in how we further describe what we mean when we say efficacy, right? Both in how we ask about it and also how we talk about it. And then over here also virtual reality is delivering certain methodologies and the games also. Now, when you think geographically, probably no surprise that the majority of companies are in the United States, or rather in North America. In North America, 102, 90% of which are in North America. In Europe, 65% of that 26 is just in the UK. Right? There's great potential, even though there are not nearly as many companies in Asia, Africa, and Latin America, and particularly given shortages, the need for anonymity owing to conservative cultures that still have above index stigma relative to the West. As well as rural conditions where telepsychiatry will be important, and huge populations. Remember, 80% of the world's population is in the east and the south of the world. Right? And then, of course, in Asia, you see that Israel and Singapore in particular, when you look at kind of clusters of companies, tend to be kind of the hot spots. Now, I say this hesitantly because I've not been able to penetrate China as well as I would like, and I have to believe that there's more happening in China than I've been able to detect. But giving China a bye for this talk, when I talk to you again, hopefully I'll have more information, Israel and Singapore really shine in that regard. When you look at the age of firms, I need to wrap this up in a couple of minutes because I do want to do Q&A. When you look at the age of firms, you can see that there's been kind of a slow trickle, right, here in the early 90s. I was surprised that there were things being developed as far back in history, right? But then this explosion happens right here, 2010, 2014. And if you look at what's been happening in terms of companies being founded in the last 4 years, we're tracking towards 50 companies in the 5-year period that will be 2019. It's interesting to kind of observe how this area has really begun to explode. And then, I don't know how many of you are familiar with CB Insights. They put out a report last fall, so it was September of 2017. I'm happy to send you a copy of this. It's one of the best, if not the best report that's been written around investment trends in the digital mental health area. And you can see that, you know, this chart, this bar right here is right within this area. So you see a lot of companies got founded. They were obviously showing good early results and had good pitch people, because then you see that there's this follow-on effect around investment, which I think bodes well, but also speaks to the temptation of greed and overpromise, which is why the ethical, responsible element of leaders needs to be a part of this evolution. It's very important that we kind of work to balance, keep that in balance as we proceed, because people's lives and people's health and their minds are in balance. Okay? When you look at investment round, the vast majority of companies are in C and Series A stage, so it's still a very young, very, very young industry with a lot of future potential, not only for growth, but also for consolidation. And right now, you see with a lot of companies, they're just trying to get users, because users yield data, and users and data make for excellent exits when the consolidation stage comes around. So, this is my last slide. So from an insight standpoint, you know, we need to redouble our efforts around professional education and influence in order to have the treater community come to trust and to be willing to use, as well as to understand how to best integrate these technologies into their practices and their systems. We need societal education and change shepherding, as I call it. So change is going to happen. The question is, how well can we shepherd it to the ends that we want to see emerge in the world in order to address stigma? Because, you know, minds recover like bodies, but we don't really believe that. We believe the body can be broken and heal, but we don't believe generally that the mind, once broken, can actually heal, just like bones. It heals differently, but it can heal. And this is something that, like I said, 15 years when my grandson goes to university, I hope that this is a well-installed attitude within society. We need to continue to gather and understand user insights around these technologies to overcome barriers around usability and adoption, as well as and then when we get those insights, we need the methods and the practices that integrate them into the solutions. We have a lot of solutions that have been developed by technologists which are being rejected at the point of execution by those that can benefit from the use of it. A lot of good stuff out there, but not as much good stuff as there could be. We need business cases that continue to attract more and more resources to this space, so that more populations globally can benefit from this potential. And last but probably most important, we need accountability for responsible adoption that addresses efficacy, security, privacy, and access. So, thank you all for your attention, and I want to stop now because that leaves us about 7 minutes for Q&A.